Frailty. Frailty means being very delicate, very small, or in fact getting into that state. Being overweight or obese is not looked upon as a sign of health, but being underweight is not healthy either. Chronic disease, major organ illnesses, psychological disorders like bulimia are well-known reasons of abnormal loss of weight. When individuals take up weight loss as a mission, body fluid loss and fat loss can lead to a leaner look. But when muscles start to lose their substance and girth, it no longer is a desirable weight loss. With extreme deprivations and attempts to reduce loss of muscle mass called sarcopenia and brittleness of bones called osteoporosis follows, and the weight loss loses its track. When such a weight loss, shrinking of the body, marked sarcopenia and osteoporosis occurs in an elderly with or without a specific cause, it's called frailty. To become frail, to become small, to become delicate and become prone to disease. In India, age above 65, weight below 60 in men and 50 kgs in women could be called frailty. Such a population is rising due to increase in number of the elderly. Frailty is not just a coined term. It represents a constellation of symptoms, signs, and complications affecting the elderly. In frailty, the person loses out on his or her reserves to lead a normal life. Physical strength, mental faculties, resistance to adversities all get gradually diminished, leading to ready-made situations for illnesses to appear. Frail elderly individual has low appetite, starts shrinking in body size, loses weight, loses vigor of life, gets withdrawn and becomes aloof. They may get into depressions and everyday tasks get difficult. Dependency on caretakers increase. Falls, heart attacks, strokes, pneumonia can ensue. This individual almost appears to surrender itself to death. Frailty, if recognized as an entity, can have a very high percentage in the population, but it generally gets relegated as old age and not acted upon. But this population is a significant duress on the healthcare system, family, caretakers, and for financial resources. Timely recognition can prevent many of these adversities that the society can face, and it comes through awareness and early report. Frailty is diagnosed medically by a slow walk speed. More than 5 seconds are required to cover a distance of 4 meters is called a slow walk. Certain mental tests are also available. Loss of thigh girth muscle, loss of mass, sarcopenia and osteoporosis can be diagnosed by CT scan. All family members should be on an alert about all elderly people at home. Abnormal falls, slowing down, repeated infections should not be brushed off as old age. Keeping a weight chart weekly would be very useful. The medical treatment part of frailty is left to experts. It will amount to reducing or replacing weight-reducing drugs, revising nutritional guidelines, periodic checks, and treatment for complications like falls, strokes, heart attacks, and infections. As a family unit, preventing and worsening can be diligently attempted. Having at least one meal of the day together with the family matters a lot. Anti-skid floors, adequate support bars, tripod sticks, attendants who promote physical independence should be put into practice. Giving the elderly a group of contacts physically and on social media is one way of relieving loneliness. Making this individual reasonably net literate can go a long way. Physical activity must be encouraged, 15 to 20 steps every 30 minutes, and soleus push-ups frequently can help in a way. Nutrition plays a huge role in combating frailty especially with dwindling appetites. Saturated fats like butter, cheese, ghee, oils improve frailty positively. Protein adequacy naturally without supplements should be attempted. Small frequent meals, prevention of constipation, and ensuring adequate deep sleep are also useful tricks to combat frailty. All in all, frailty is a modern day disease, a combo of increased elderly population, social apathy, dwindling family supports, and a lack of open-eyed approach in nutritional advice and medication. It can be a social menace drawing on to many resources. Fortunately, it can be diagnosed early. Simple working tools and not fancy expensive treatments are required to prevent frailty, to arrest frailty, to prevent its worsening, and of course, to tackle the complications.